Go through a lot.
Alarming new research coming out of South Florida shows youth suicide rates are rising. And we're not just talking about teenagers. Children as young as 9 and 10 years old considering permanent solutions to temporary problems.
WEAR Samantha Serban joining us in the studio now with the options available to turn that trend around. Samantha?
Yeah, new resources are coming online all the time to try to help our kids. We've got counselors in schools and mobile response teams to eliminate transportation as a barrier to help. And talking with a couple of teenagers myself, it may not work for everyone, but they say more informal, relaxed group settings help them the most. Every day, an average 3,700 high schoolers attempt suicide, according to the Jason Foundation. If successful, that'd mean the U.S. would lose 1.35 million teens a year.
This is very worrisome.
That's why Dr. Maria Carmenza Mejia from Florida Atlantic University co-authored a study on teen suicide. The results, more alarming than you may imagine.
Suicide has become the second leading cause of premature death among those between 10 and 24.
More than cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and chronic lung disease combined. But that age range isn't the only one seeing an uptick. Take a look at this. This graph shows suicide rates for preteens, 8 to 12 years old, the rate tripling over 16 years. Something licensed mental health counselor Autumn McAllister has seen firsthand.
It's going from having these thoughts of your own mortality and to 9, 10-year-olds having actual methods and plans.
The question is, why?
And social media usage has surged. So it is posing teens to online bullying, comparison distress, and body image concerns.
Statewide data from the CDC shows an increase in the number of high school students who attempted suicide since 2007. A similar uptick seen in high school students who seriously considered attempting suicide. Unfortunately, this data isn't broken down at the county level. We do know, however, at least 8 kids died by suicide this year alone in Northwest Florida, according to the medical examiner's office. So, how can we turn this trend around?
Addressing a stigma is key. Addressing a stigma in teen mental health means understanding that serious mental health issues should not be dismissed as just teen moodiness, right?
Here in Escambia County, the school district works through that with a layered approach, starting with anti-bullying, drug awareness, and mental health campaigns, moving up to school-based support, and then mental health counseling.
So if you're struggling with these thoughts, we can get help.
Melissa Williams is the coordinator of mental health. She says Escambia County is seeing more and more kids coming in.
That's also a good thing because students are saying, hey, I need help, and they know where to go.
Schools can only do so much with their budget, though. So let's look at what is available outside school walls. You've got Lakeview Center's mobile response team breaking down transportation barriers. You've got individual therapists. But as far as more intense inpatient programs,
We only have one children's facility, and that's Baptist Hospital. So that's probably where there's the greatest need in our area, is looking at what do we have for a children's inpatient.
Fortunately, not all students need that level of care, but they do need something.
Because teens and preteens go through a lot.
Javon Washington and Akaylin Harris are part of a peer empowerment group with grassroots organization Youths Left Behind. They talk weekly about mental health, substance abuse, violence, all while learning leadership skills and how to rely on one another.
I really feel like it really needs to be more like places like this for people, like young people my age, that are battling mental health challenges.
And while these two haven't struggled with suicidal ideations themselves, they do have a message for kids on the edge.
They're always wanted and loved in this world, so they don't do anything drastic that can change someone they love or their life forever.
Parents, guardians, family, and friends, where can you get help for young people in your family? We're going to put a plethora of resources on our website for you. Just click on this story. In studio, I'm Samantha Serban.